Welcome to Mosharrafa Plastic Surgery. I'm Dr. Ali Mosharrafa. I just wanted to give you a flavor for what happens when you come in for your first consultation. This is our waiting room. This is where you'll be greeted. I'll come out and meet you here actually and say hello, introduce myself to you. If you're with family, husband, wife, children, mother, friends, we're going to all come back together and we're going to walk this way. I'm going to bring you right into our exam room. And I'll close the door just so we can chat for a moment. This is where we get to know one another. And I introduce you to myself, tell you a little bit about my background, where I'm from, where I trained, how things work here, introduce you to the staff members, the facilities we have here, the physical facilities, and all of the safety metrics we have to keep you safe and comfortable throughout your journey. After we've gotten to know one another, with you fully dressed, family here as well, then I step out and have you change. We have a robe waiting for you. If it is a body consultation, we'll make sure that you're comfortable. Obviously, if it's a facial consultation, there's no need to change at all. And when I come back, we do an examine the pertinent areas that are of concern to you. And then we have the clinical discussion about what options are available to you, what I would do if you were my family member, the safe, predictable, and established procedure for your care. We go over all the details, the surgery, the recovery, the risks involved, how it affects your work, time away from family, children, walking the dog, all the things that are part of your life. We want to make sure you have a great understanding of what commitment is made and the downtime involved. Once we're done with the clinical discussion, then we have a monitor there that we use to display before and after photos, and that's an opportunity for you to see my work. We do photograph all of our patients and we review those results together, and we've been very fortunate to have many patients allow us the opportunity and give consent so we can use their photos to help you understand what to expect from your procedure with similar anatomy and similar surgery. Once the clinical piece is done, I step out. If you do need photographs on your first visit, we get those now. Those become your before photos and become part of your permanent medical record. And then finally, after we're done with the clinical discussion, you get to meet Haley, who's our patient care coordinator, and she goes over all of the financial terms which are pertinent to your procedure, and she's also my surgery scheduler, which helps you to choose the best date for you in your schedule. So that's the process. We try to cover the clinical information, the financial information, scheduling information, all on your visit. It's a very relaxed visit. Of course, most importantly, we want you to feel safe and comfortable here. And really, it's an opportunity to get to know one another so that you can be comfortable and feel like you're in the right place where we can care for you properly and make sure that you're comfortable with our surgical plan. Hopefully this helps alleviate some of the fears and unknowns about that first consultation. It is a very comfortable experience, and again, we're going to do our